There could be some light at the end of the tunnel for the coronavirus pandemic because tonight there's another vaccine breakthrough. Moderna says with a 94% efficiency rate, it is now filing for emergency use authorization. It's now the second company to do that, and it kickstarts a new timeline for a potential vaccine. Health Secretary Alex Azar says the first two COVID-19 vaccines could be available before Christmas.
Yeah, today Azar and Vice President Mike Pence spoke with all the nation's governors to determine how the first doses will be distributed. News 5 anchor Mike Brookbank gives us a look at how it will all work out right here in Northeast Ohio.
With a pair of COVID-19 vaccines pending emergency use authorization, anticipation is building as questions remain about distribution.
If we had the vaccine in an EUA, we could be ready to go, probably within 24 to 48 hours.
Tuesday, a CDC committee will meet to decide who gets priority. It's expected to mirror Governor Mike DeWine's plan to vaccinate frontline workers and high-risk patients first, with now the possibility of also including residents at long-term care facilities in that first round.
That may happen, and we're prepared for that should it happen.
We have two sites in Northeast Ohio, Metro Health and the Cleveland Clinic, that will have a stockpile of the vaccines prior to getting FDA approval for quicker distribution. They may not be a pre-positioned facility, but university hospitals, which studied the Pfizer vaccine, is also ready.
We do have some of that on site, and we also expect to get a shipment within days of the emergency use authorization as well.
Robin Strosaker, Chief Operating Officers at University Hospitals, tells me she doesn't expect a lot of lag time or side effects.
Maybe a little soreness in the arm, maybe a little redness in the arm, maybe flu-like symptoms for 24 hours after the vaccine, but largely very, very, very mild.
With a robust mid-December rollout for those at highest risk, the general public can expect access by the second quarter of 2021.
April, May, June, springtime.
The companies behind both coronavirus vaccines claim they're more than 90% effective, much higher than the flu vaccine.
The science is different between the COVID vaccines and the flu vaccines, but we were very, very happy with the results of both the Moderna trial and the Pfizer trial. I think it's really encouraging that we can be in a very different situation by summertime.
That is, if everyone steps up to get the shots.
It will be harder to get out of the pandemic if people don't want to get the vaccine. I mean, this really is what's going to get us out of this most quickly. We will do everything we can as a healthcare system to make sure we continue to educate folks and help them understand why this vaccine is so important, why we believe this vaccine is safe, and we'll do everything we can to get it distributed as quickly as we can.
Reporting in Cleveland, Mike Brookbank, News 5.